Donald Trump said, "I support health care for people. I want people well taken care of, but I also want health care that we can afford as a country. I have friends closing down their businesses because of Obamacare." Today I would like to tell you why I think that we should repeal Obamacare in favor of personal health savings accounts. A lot of people have heard a lot of different stuff about Obamacare, especially a lot of the stuff that the president said that's come to be untrue. I'd like to tell you a little bit about Obamacare and why it should be repealed. I'd like to tell you what a health savings account is and what the benefits are of switching to them. Obamacare needs to be repealed because it's going to cause job loss and it's going to make the cost of healthcare and cost of healthcare insurance rise. An article by Art Kelly said that according to the International Franchise Association, 31% of franchisees and 20% of franchisors plan to cut jobs to make sure they have less than 50 employees. 50 employees is a number that Obamacare has put out that regulates different penalties and insurances once you get that high, so they want to be under that to help cut costs. Fox News found that Obamacare taxes caused Stryker Medical Supply to cut 1,170 jobs already. Pennsylvania Community College announced that they can save about $6 million a year by cutting the hours and some employees out of 400 adjunct and part-time workers. The Mercer consulting firm did a study showing that 51% of businesses plan to reduce employees and hours in order to avoid Obamacare requirements and penalties. Also, that study also found that 20% of businesses plan to see a 5% price increase, 14% expect to see 3 to 4% price increase, and 29% still don't really know what to expect. Rick Santorum found that the nonpartisan Congressional Budget Office says that Obamacare will result in an estimated 800,000 fewer jobs. Although this president has said that Obamacare is going to decrease the cost, that isn't the case. In an article by Paul Howard, I found a lot of interesting facts about why we should realize that it's going to raise them, like New York, New Jersey, Vermont, Massachusetts, and Rhode Island all have similar healthcare laws and regulations, and these 5 states have some of the highest insurance premiums and healthcare costs in the entire nation. The Society of Actuaries estimates the cost of treatment to go up on average of 32% per person. But in states like Wisconsin and Ohio, they said they may see up to an 80% increase in costs. Forbes.com also had a list of other reasons that I would like to talk about why Obamacare is going to increase cost. Paperwork is one major increase factor because the doctors and other healthcare workers are going to have to do more paperwork, so they may have to hire more people or do more work themselves, which means employees will get paid more, so your costs will go up to help them keep making the same amount of money they are. Young people are also going to be forced to pay more so that people that are over the age of 60 don't see as big of an increase because a lot of them are on fixed incomes. The Obamacare law also raises tax that the insurance has to pay on the premiums. So in order to make the same amount of money that they are now, they're going to have to raise the premiums so that they can handle the extra taxes. They're also going to be forced to be more generous with their payouts and what they cover. Because of this, they're going to have to bring in more money, otherwise they won't be able to afford the extra costs. They're also going to be forced to accept sick people that already have a lot of problems. This means that they're going to have to pay out more insurance payments for them, which means everybody else's cost is going to go up to help with that. The United Health Group Incorporated said that personal premiums could raise as much as 116%, and businesses should expect to see a 25 to 50% increase at least. Health savings accounts, I think, are the best way to go around Obamacare to make sure that people can handle their own health insurance. The Mayo Clinic had an article with a lot of information about health savings account. Health savings account are like personal savings account, except you can only use them for healthcare costs. In order to qualify for a health savings account, you must have a high deductible insurance, which means you have to pay more money out of pocket before they will start to cover care. The higher deductible on your insurance is like a car insurance. If you have a higher deductible, your premium will be lower. I think that whenever people are born, they should be given a health savings account, and then as they work, they should pay into that instead of paying into the government. They will save up money throughout their youth because statistically, youth people do not go to the doctor as much and they have lower healthcare costs. Then whenever you get older and you have to have more health problems, then you can use money that's already saved up because the balances will roll over. Whenever you pass away, your health savings account will be like any other part of your inheritance to your family. You can pass it down to your kids' health savings account or even your grandkids to help them pay. Generations would continue to pass down money because most people probably wouldn't spend the amount they'd save in their lifetime, which would help out with people who are born later in your family that have a lot of health problems and need to go to the doctor a lot. The benefits for having a health savings account are very vast. In the business section of the Chicago Tribune, I found that you don't have to pay taxes for what you pay into your health savings account. This means that out of your check, you can save more money than you would without taxes being taken out. You also get tax-free earnings. So if you invested in stocks and bonds or any other way to earn interest, then you don't have to pay taxes on it, so your earnings are really more. Your money rolls over from year to year, so you can just keep building on top of it until you finally get old enough to where you start to need to really take it out. Another benefit is that you get to shop around for the coverage you want. This will help decrease costs because doctors will have to compete with other places, just like any other business has to compete price-wise, but this will also make the care better because doctors are going to need to have the best care for the right amount of money to get your business. In a study of 70,000 people who use health savings account, Donald Mazzella found that 62% carry over at least some balance from year to year, and 55% state that they're using that as a savings medium for later in their life. Now that I've told you a little bit about Obamacare, I would hope that you would agree that it needs to be repealed, and health savings account would definitely be a good option to possibly go with. As Tom Scott once said, Obamacare, get rid of it, period.